Alright everybody, welcome back to the San Diego Miramar College EMT skills videos. Today we'll be talking about the blood glucometer. This is an EMT skill you can perform in the county of San Diego, so let's take a closer look. Okay, so here we have our blood glucometer. There's many different brands, there's many different types, but they're all basically the same kit. So you open it up, here you've got your actual glucometer, here you've got some test strips, and then in this pocket you'll usually find some gauze to wipe away blood, a bandage to put over the finger after you are done, alcohol prep pad. This device is called a lancet. This is how you will obtain the blood sample. And then, depending on the brand or manufacturer, you may have a couple calibrating fluids. So we'll put all this off to the side here. Now, the glucometer, depending on which brand you have, sometimes needs to be turned on by actually inserting the test strip. That's the case with ours. So you will take the test strip out of the container. Now on the test strip, you will notice, I don't know if you can see, but you will notice these two black lines as opposed to this one white line. The side with the two black lines is what gets inserted into the glucometer. This is where you insert the test strip and it actually turns on the glucometer. That code 69 corresponds with a code on the side of the test strip can. So now let's talk about how to actually obtain a sample from a patient. Okay, so let's get started. We've got all our equipment here. We've got our mannequin, that'll be our patient. And keep in mind, this skill is indicated anytime your patient has an alteration in mental status. So we're going to start the skill, obviously, standard precautions, scene safety. The first thing you're going to do is assemble your equipment. I've already done that. And then we're going to take our sterile alcohol prep pad out of the packaging. Sometimes patients do have a preference which finger you poke, but you want to keep it to their non-dominant hand, and on the side of the finger is ideal here. So we're going to wipe the side of their finger with our sterile alcohol prep pad. We'll take that, throw that away. Now we want the alcohol to dry before we poke them with the lancet and before we obtain the blood samples. So while the alcohol is drying, we can take our glucometer, insert the test strip so that it turns on. Now that the alcohol has dried, we will take our lancet. This particular brand of lancet, there's many different brands. This one, you turn the top until it is removed, and then there's this lever here, and with this side, the side that you pulled the top part out of, you're going to place that against the patient's finger, and then on the count of 3, 1, 2, 3, you hear that click, and you should see a drop of blood starting to form on the forefinger. Even though this is a safety needle, you're going to have to throw this away into a sharps container like this one, so we'll just toss that in there. Now, this is a mannequin, so it's not going to really bleed, but the first drop of blood you need to wipe away because there's potential it is contaminated with the alcohol and could produce a false reading. But once you have the first drop of blood wiped away, we can obtain the second drop. You might have to squeeze their finger a little bit. But once you get the drop of blood, I want to show you guys so that it's a little more clear, but it's very important that you use the wicking effect of these test strips, because if you were to just put the drop of blood, say, on the top of it right here, you're not going to get the wicking effect and it's not going to read appropriately. So our reading here, we have 37 milligrams per deciliter, so that would be hypoglycemic. If this patient is able to swallow, we can treat with oral glucose. If not, we need to activate ALS. so they can come and start an IV. Now obviously this patient still has somewhat of an open wound here, so we're going to take our bandage out of the packaging and place this onto our patient's finger. Obviously this will all go into the trash. What you use to wipe the blood off with will go into biohazard, and then same with the test strip. You'll put it into the biohazard can, and that is typically done by ejecting.